Hey everyone, and welcome. Today we're going to talk about something that's incredibly common, but, not that well understood. Squamous cell carcinoma, or as you'll hear it called, SCC. It's one of the most widespread skin cancers out there, and knowing the basics could really be your best line of defense.
Okay, let's kick things off with a number that really puts this into perspective. Over 100,000. That's how many new cases of SCC pop up in the US alone every single year. So this isn't some rare, obscure thing. It's a major health issue that we all need to have on our radar.
So where does SCC fit into the whole skin cancer picture? Well, you've probably heard of basal cell carcinoma, right? That's the #1 most common type. SCC comes in at a close second. But here's the kicker, the really important part. It can be more aggressive and it has a higher chance of spreading if you don't catch it early.
And that brings us right to our first big question. What is squamous cell carcinoma, really? Let's break it down, starting from the very cells where this whole thing gets started.
Okay, so at its very core, SCC is a cancer of your keratinocytes. Now, what are those? They're basically the main building blocks, the workhorse cells that make up the epidermis. That's the outermost layer of your skin. With SCC, these cells go haywire, they transform, and they just start multiplying completely out of control.
So, what should you actually be looking for on your own skin? Well, SCC can be a bit of a chameleon. It might show up as a rough, scaly patch, maybe a firm red bump, or even a sore that just will not heal. Seriously, if you notice a spot that keeps crusting over or bleeds without much reason, you've got to pay attention. Catching these signs is absolutely key.
SCC doesn't just appear out of the blue. It follows a pretty clear progression. It often starts out as a little precancerous spot called an actinic keratosis. If that's left alone, it can become in situ, which basically means it's cancer, but it's playing nice and staying contained in that top layer of skin. From there, though, it can become invasive, pushing down deeper. And in the most serious cases, it can metastasize, which means spreading to totally different parts of the body.
All right, so that leads us to the big why, doesn't it? What causes this to happen in the first place? Let's dive into the main causes and all the risk factors.
This quote really just nails it. Think of your DNA as the instruction manual for your skin cells. Well, UV radiation from the sun acts like it's constantly making tiny little typos in that manual. Over years and years of sun exposure, those typos add up, until finally you get a critical error that basically tells a cell to just grow and grow and grow without stopping.
So, who are the usual suspects here? Well, #1, no surprise, is all that cumulative sun exposure over a lifetime. But it's not just the sun. Having a weakened immune system, say if you're an organ transplant recipient, that dramatically increases your risk. Other big ones, having fair skin that burns easily, being older, being male, or, of course, having had a skin cancer before.
Okay, so let's say you or your doctor finds a spot that looks a little suspicious. What happens next? Let's walk through how it gets diagnosed, because the process is actually very clear and methodical. And this is the essential question, isn't it? For you, for the doctor, for everyone. How do you go from just suspecting something's wrong to knowing for sure what you're dealing with?
It really boils down to a 3-step journey. It all starts with a thorough skin check by a professional. If they see a spot they don't like, step 2 is a skin biopsy. They'll just take a tiny little sample of it. And finally, step 3, that sample goes off to a lab where a pathologist looks at the cells under a microscope. That right there, that's the gold standard. It gives you the definitive answer.
So what is that pathologist actually looking for? Well, to confirm that it's invasive SCC, they need to see those funky, cancerous keratinocytes on the move. They're looking for evidence that the cells have broken through something called the basement membrane. That's kind of like the floor between the top layer of skin and the deeper layer, the dermis. That's the smoking gun that tells them the cancer isn't just on the surface anymore.
Once that diagnosis is locked in, the whole conversation shifts to treatment. And here's the good news. We have some excellent, really effective options available, and they're all tailored to the specific cancer you're dealing with.
Let's look at the plan based on the stage. If you catch it super early while it's still in situ, treatments can be pretty simple, like freezing it off or using a medicated cream. For invasive cancers, surgery is the go-to approach. And in those rare cases where it has spread, doctors bring out the heavy hitters, a combination of surgery, radiation, and powerful systemic drugs like chemotherapy and immunotherapy. Okay, let's zoom in on the 2 main surgical options. With a standard excision, the surgeon basically removes the tumor plus a little safety margin of healthy skin around it, all in one shot. Mohs surgery, on the other hand, is incredibly precise.
The surgeon removes the tumor one thin layer at a time, checking each one under a microscope right then and there. They keep going until they hit a layer that is 100% cancer-free. It's an amazing technique for saving as much healthy tissue as possible.
And the results? They speak for themselves. I mean, both of these surgeries are highly effective. A standard excision has a cure rate of around 92%, which is fantastic, but Mohs surgery, with that incredible precision, pushes that rate to over 97%. Now you can see why it's often the #1 choice for cancers in tricky spots, like on the face, or for tumors that are a bit more aggressive.
We've covered what SCC is, why it happens, and how it's treated. But now we're at the most important part, what this all means for you and how you can really take control of your future skin health. Honestly, prevention is where you have the most power, and it comes down to 4 key habits. We all know them, but they're so important. Use a good, broad-spectrum sunscreen and reapply it. Wear protective clothing. Hats and sunglasses are your best friends. Try to seek out shade when the sun is at its absolute strongest. And finally, get to know your own skin. Perform regular self-exams so that you're the first one to notice if something new or different pops up.
And this number is exactly why you can't let your guard down. After you've had one SCC, your risk of getting another one within just 3 years is about 18%. That's at least 10 times higher than the general population. It's your body's way of telling you that the underlying sun damage is still there, which makes ongoing sun protection and regular skin checks absolutely non-negotiable.
So I'll leave you with this one thought. It's one thing to hear all this information, but it's another thing to actually use it. So think about it. What's one simple step you can take starting today to protect your skin for all the years to come? Thanks for joining us.